And good morning, everyone. Welcome into a brand new edition of Sports Medicine Weekly on this Saturday morning. I'm Steve Kashul. So happy to be joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls and one of the team physicians for the Chicago White Sox, a sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our producer is Shane Reardon, and our website is sportsmedicineweekly.com. How are you, Doc Cole?
Steve, I'm doing great this morning. Great to talk to you again.
Great. Hey, I'm going to start with something. I spotted this on Twitter, and you were involved. A local TV station did a story on you and BandGrip, which I thought was just fascinating, and I wanted to make our listeners more aware of this. It's the first non-invasive wound closure device featuring micro-anchor skin closure technology. Kind of takes the place of needles, staples, and sutras, correct?
That's right, Steve. This is something that we've been working on for a couple of years because, first of all, it's incredibly anxiety-provoking when a patient has to come back for wound management after surgery, for example. And it's a device that replaces staples or sutures to close the incision. And it's become especially relevant now because patients can actually take it off themselves in their homes. So when we transitioned from telemedicine and we were still doing essential surgery, what was happening was we would have patients with a video. We would actually teach them how to take it off, which is very easy to do. Now they can just do it on their own and don't have to come into the office, get staples or sutures removed. Most importantly, they can monitor their incision post-operatively. It shaves off wound closure time by 2/3, and it's become a very efficient, sort of cost-effective solution. But we think it's actually leading to better-looking incisions long-term, especially in patients who keloid. Keloiding is when the incisions widen over time. So there's been a lot of benefits, but they became especially apparent now at this time when we have trying to limit the amount of office visits. So rather than having that office visit 7 to 10 days, we do it by phone, and we can have the patients change their own dressing and manage their own incision without any anxiety.
Hey, Dr. Cole, tell us, how wound closure techniques have changed, in the past kind of 10, 15 years. Was it always just kind of I'm picturing needle and thread, in the operating table, but has it become more advanced from where you first started?
Historically, wound closure was always either using staples, which are really uncomfortable to get removed, and they leave these permanent holes or marks in the skin in lots of patients. Then we gravitated towards the use of sutures, which we sort of bury, like you say, sort of needle and thread. And that has been sort of the mainstay, but it takes a lot of time. It takes a lot of time to actually do that closure, and in addition, there's a foreign substance, the suture there, so the infection rate, while very low, is not zero. So if you can close an incision without leaving anything behind and get the foreign matter out of there very quickly, or in this case, get the adhesive bandage off quickly, it's basically like the male side of a Velcro, Steve. So it's a clear plastic dressing with an adhesive that is what we call hypoallergenic, and it's a pressure-sensitive adhesive that has these little micro hooks like you'd see from Velcro, and they literally just kind of stick into the skin and hold the edges of the wound together long enough that the body heals it, and then at 8 to 10 days we just remove it. And that is a whole lot easier than pulling a suture, which is what we customarily have done over the last, since I've been in practice. We've always used sutures, which take a lot of time, but also have a foreign substance there, and that's completely eliminated it.
And it reduces the likelihood of additional scarring, I'd imagine?
We believe, and I've had a number of patients, for example, in shoulder work, I often have patients who you can see from previous surgeries, they keloid, they get these widened incisions healing, and we have had patients who historically would get that, and then once we do the closure with this, they're not re-keloiding again. So our belief is that it can prevent keloid formation.
Oh, I think that's great, and this is something with a group in Chicago. Am I not mistaken that created this?
Yeah, the developers and the engineers are from the Midwest, and it's manufactured local in the United States, in Milwaukee, I believe. And the great thing about this company is that we've come up with a lot of adaptations for different specialties within orthopedics and even non-orthopedics, where we say, look, maybe a different size, a different configuration, and they're extremely nimble and have been able to make adaptations based upon the surgical procedure. So I think it's going to become sort of the gold standard in a lot of areas, not just orthopedics. We are seeing an uptick in people who like it in OB, GYN, as well as general surgery.
And yeah, that was my last question about this topic, Dr. Cole. Patients, what has their reaction been to this new BandGrip technology?
Well, we started using it actually in the training room for lacerations because it's a quick closure. I know that it's been used in hockey, and I have colleagues who I've introduced it to. So I will tell you, from the athlete's perspective, it's very well received because we're not having to numb them up and put sutures in acutely in the training room. In addition, it has a potential play for just if you had a laceration at home, rather than using a butterfly bandage or going a trip to the emergency room, you could actually close your own laceration by putting this on with no stitches. And from a patient's perspective, they've been really accepting of it because they don't have that anxiety that comes with when you come to the office to get staples or stitches removed, which is really, it's uncomfortable. The wound is sore, it's often very inflamed, and this completely eliminates that step. So I'd say the patient acceptance has been very high.
Yeah, and you could do this with telehealth, right? I mean, people are at home; they don't need to come in then to take off this BandGrip, and you can just kind of guide them through it through telehealth.
Correct. That's correct.